Morning.
Well, good morning. Good morning, everyone. I'm Senator Jim Seward, Chair of the Senate Insurance Committee, and I'm delighted to be co-hosting this roundtable with the Chair of our Health Committee in the Senate, Senator Hannan. We've also been joined this morning by the Vice Chair of the Health Committee, Senator Valesky, as well as the Ranking Member of the Health Committee, Senator Rivera. And I think the fact that we're having this roundtable on the demise of Health Republic and preparing for the future in terms of other health plans and health coverage in New York State on the very first day of session, I think underscores the importance of this issue at hand. This past fall, when we saw some 215,000 subscribers of Health Republic scrambling for coverage because of the shutdown of Health Republic, that's a serious problem facing those 215 or so thousand New Yorkers. Also, the issue of unpaid claims regarding the demise of Health Republic, 200 million plus. I've heard numerous numbers. It's north of that, perhaps. That's one of the issues we may want to get into. Loss of commission in terms of brokers. There are ramifications far and wide in terms of the demise of Health Republic. We're here this morning to discuss all of this. Certainly the impact on these subscribers that I've mentioned already, the status of providing alternative coverage, the financial impact on our providers, our local hospitals, physicians, other medical providers, as well as our brokers, and also the larger issue in terms of financial stability in the marketplace when it comes to health insurance, and which I think begs to a review of the current implementation of the prior approval process and its impact on the stability or lack thereof in the marketplace when it relates to health insurance. We want to avoid any further market disruption, bottom line. And so that's the reason for being here this morning. I certainly want to welcome everyone and then turn it over now to Senator Hannan.
Thank you. Thank you, everybody, for being here. Pretty important to be here. Thank you to Donna Frescatore, head of the exchange, Troy Oshner, the chief regulator. Appreciate your being here. It was a couple of months ago that we learned about the demise of Health Republic, and it was luckily, in one sense, to me, that we were at a major conference in New York City put on by the New York State Health Foundation, able to network with a lot of the people involved, and asked the administration at that time to do one main thing, which was take care of the people who were covered, the patients, because that was really the ultimate thing we needed to do, and they did. Can't say it was totally elegant, but in the circumstances, I think it was probably the best that could be done. And now we have the aftermath. We take the longer view, see where we go, what can happen, what type of statutory changes can be made. Is there any chance for making payments? I was kidding Senator Seward before. Well, the Senate is taking care of looking out for the economic well-being of everybody. We sent Mahika over to be budget director. Given all of that, I'm going to be a little bit of a martinet and try to keep people conversing and not making speeches. So I want to go around the room, give everybody 1 minute to introduce themselves. And then when we're finished that, we're going to come off and ask the folks from the administration to make some comments. So in no particular order, start off with there. Craig, would you just 1 minute and then you...
Thanks. My name is Craig Hasday. I'm the legislative chair for the New York State Association of Health Underwriters, serving all New Yorkers in navigating this mess. We continue to work with the regulators and with the exchanges and in trying to help everyone get paid for health care, get adequate health care, get affordable health care in a vibrant marketplace.
Doolin.
Good morning. I'm Sean Doolin with Hinman Straub, representing the Conference of Blue Cross and Blue Shield Plans. What's unfortunate here is that the demise of Health Republic was not surprising. Indeed, it was predictable. From the outset, their rates were questioned, particularly in 2013 when they had not yet entered into provider contracts. Conventional plans knew it. The rest of the industry knew it. The providers knew it. And as the years played on, you expected significant rate adjustments. They didn't occur. And there are lessons to be learned, both in terms of the prior approval process as well as enforcing current solvency standards.
Okay.
And, there is also precedent.
Just a minute. Mr. Golden?
Hi, I'm William Golden. I am responsible for the Northeast region for United Healthcare. Through our Oxford products, we cover more New Yorkers on our small business platform. We are tremendously interested and looking forward to this discussion today. We think a lot of what we talk about today could have been prevented. We think there are some holes in some of the processes that we have to follow in order to get rates approved and filed. And quite frankly, one of the things I'd like to advance today is in the prior approval process, quite frankly, I think the major concern of our regulators should be the appropriateness of rates, not that they're too high, that they're too low. And I think we wouldn't be sitting here if we had taken that approach a number of years ago.
Okay, thank you. Ms. Shore?
Good morning. I'm Kathy Shore, Senior Vice President for Managed Care and Finance with the Greater New York Hospital Association. We represent hospitals across New York State, as well as in a number of additional states. There are a lot of different factors that contributed to the demise of Health Republic, and I think what I would like to do today really is focus on what we can do going forward to mitigate the impact of any future insolvencies.
Thanks. Now, Ms. Frescatore, Mr. Oshner, you can open, and we'll still come back to you.
Okay,
Make your
great.
choice. What would you like to do?
Why don't we come back?
Okay.
I'm Donna Frescatore, Executive Director of New York State of Health, though, as far as introductions.
Yep. And my name is Troy Oshner. I'm the Acting Executive Deputy Superintendent for Insurance. Really long title, but basically running in the insurance side of Department of Financial Services.
We have to get you a quickly
Yeah.
title.
Yeah, for bigger name tag.
Start over there, representing the Medical Society.
Yes, hi. My name's Liz Deers. I'm Senior Vice President for Legislative and Regulatory Affairs for the Medical Society. My physician is not yet here. We represent, Medical Society represents solo, small group, large group, and employed physicians across New York State. And like Ms. Scher, we would like to talk about what we can do moving forward to assure that our physicians are recompensed for the services they provided during the demise of Health Republic.
Thank you. Mr. Gold?
Good morning, Senators. Jeff Gold from Haney's. Along with Kathy, we have been surveying to see what the extent of the damage is. I think we're around $170 million in terms of hospital debt. I think, particularly since a number of us have been working on the state's value-based subcommittee on regulatory reform, we keep coming across, and talking about Sean and Kathy and Harold and a number of others at the table, the recognition that as entities start taking on risk, there has to be both a balance between the amount of oversight necessary and kind of what are they putting up in terms of reserves, and if they don't have reserves, it necessarily follows that the oversight has to be tighter. There's kind of a seesaw to that. And I think what we've felt about Health Republic looking in the rearview mirror is that its collapse was too predictable, the intervention was too late. When things happen, they happen too slowly, and the hole is too deep. So there are a number of ways to avoid that in the future that are both going to address.
Okay. This has a bell on it, too. Mr. Maslach.
Paul Maslach, President and CEO of the Health Plan Association, represent the scope and spectrum of plans in the state, from national plans to regional to the government program plans, which are now in the state exchange. Our concern, which we'll get into going forward, is the viability of the exchange and concern about access and choice for consumers, and that due to inadequate rate setting and inappropriate rate setting, it's threatened, and consumers will be threatened in the future with their access and choices if plans exit the market, either like Health Republic or on a voluntary basis. Secondarily, we're concerned about affordability, and by that I don't merely mean the premiums for affordability, but the underlying costs. And we need to consider that, think about that, and for you, the legislature, you need to think about the HICRA taxes and the burden that imposes.
Mr. Island.
Harold Island with Greenberg Traurig. We represent the Health Plan Association. The demise of Health Republic was, as you will hear more later on, a perfect storm of problems. As everyone's noted, very predictable. Higher unit costs, underpricing of premium, huge and largely unchecked growth, failure to provide federal funding, and one other issue I want to underscore, which is a company that had no access to capital. And that's a very important issue. And as we look at this, I will note that I think this is a fact pattern that does not exist for any other health plan in New York. Both for-profits and nonprofits both have much more access to capital than Health Republic had. Now, when we talk about the solution, I think it's important that we keep in mind that there are two aspects. One, how do we pay the unpaid claims? That's one issue. There is a second issue, do we need long-term structural reform? Those are not the same thing.
We'll come back. Dr. Hayward.
Thank you, Mr. Chairman. I'm the CEO of the Mount Kisco Medical Group. We're 425 physicians in the Hudson Valley of New York. We take care of over 500,000 patients. And we take care of roughly 6% of the Health Republic patients who are our patients. And you need to realize that it's more than just our doctors not getting paid for their visits. We put out a lot of money for vaccines, for chemotherapy, for a lot of other expenses that were necessary to take care of the patients. But we did take care of all the patients. But obviously, our physicians expect to be paid like any profession for any work you do and do it in an appropriate way. They expect to be paid for their services.
Thank you. Mr. Anderson?
Thank you for convening the meeting. We appreciate that. I'm Dave Anderson with Health Now. We operate as Blue Cross and Blue Shield in Western New York, primarily in the Buffalo region, and we operate as Blue Shield health plans here in the Capital District. We have about 1 million New Yorkers that we serve, and I'm here as a regional health plan. We operate in 20 counties in the state. We don't operate outside the state. The economic environment around health plans has to work in order for us to exist. We can't go to Pennsylvania or Massachusetts or Texas or Colorado and subsidize what we need to do and need to serve here in New York. So I would echo the comments that this was predictable. There were plenty of signs. It's unfortunate that its demise had to bring us together and have this conversation. And I hope we can have a thorough conversation around the rate-setting environment.
Thank you. Good timing.
I think we ought to note that we've also been joined by Senator Betty Little. Thank you.
And Assemblyman Dave McDonough. Okay. Now, I'm trying to, in my mind, who should go first, so I'll let you two decide.
Okay. Batter up. First, thank you very much, Senator Seward, Senator Hannan, the rest of the committee members. Really appreciate the opportunity to engage here. The big picture here overall is that the ACA has been a big success in New York. More individuals are covered than ever before. Individual rates are lower than ever before, and the coverage is offered by more health plans than before the ACA. Unique challenge presented here, notwithstanding that success, has been Health Republic, and as Harold noted, it's a unique challenge, and it's been a challenge for the state, it's been a challenge for providers, for health plans, for brokers, and certainly for consumers and employers. The fortunate piece about this story is that Health Republic has showed that the state, with decisive action and working in coordination with providers, plans, and brokers, can meet the challenge, this extraordinary challenge that was presented. Now, again, as Harold noted, Health Republic was a unique health plan. It was a federal cooperative, and to understand Health Republic and what went on here, starting place is really understanding the federal co-op program. Harold noted the access to capital, and funding was a huge issue for Health Republic. Unlike other plans, didn't have access to outside capital, was reliant.
I asked the sound people, can we do anything about the gremlins? They're working on it.
I'll keep going. So,
Sorry.
that's all right. So Health Republic, like all co-ops were intended to be funded solely through federal funds, and that meant that they were subject to the federal appropriation process. Congress did two sets of things. First, converted the loans. They were supposed to start out as federal loans. Federal grants, converted it into loans. And then next, in two separate budget bills, Congress slashed the program from $6 billion down to $3.4 billion, and then after that, prohibited HHS from issuing any more loans after they had reached only $2.4 billion. So access to capital was definitely an issue and a unique issue for Health Republic. On top of that, in addition to dealing with that, we have the Risk Corridor Program. The Risk Corridor Program, as many of you know, the idea behind it was to, as a federally funded backstop for health plans if they might underprice premiums in 2014, 15, and 16, which were really difficult years because of all the uncertainty, particularly in the individual market and particularly in states like New York, where we had such a broken market. In December 2014, Congress imposed a revenue neutrality requirement on the Federal Risk Corridor Program. And what it meant is that federal dollars would no longer be used to support the program, and so that the amounts paid out of the Risk Corridor Program would be limited to the amounts paid into it by other insurers. And the impact of this, even though this happened in December 2014, it wasn't until October 2015 that everybody understood how little money would actually be available in this program. It was only 12.6%, and this hit many co-ops, particularly Health Republic. So the difficulties of the federal co-op program and risk corridor programs contributed to a wave of shutdowns of co-ops across the country. As you may know, more than half of the co-ops have shut down, 12 of the 23, east, west, north, south, all over. And so the experience of Health Republic isn't unique to New York. So in light of that, DFS had been monitoring Health Republic's finances from beginning to end. We acted decisively to protect consumers, providers, and we met or exceeded all of the national financial oversight standards. From the start, DFS and CMS put certain financial guardrails in place. We put them on a heightened reserving requirement. They were at 500% of the risk-based capital, or RBC, rather than 300%. And we put Health Republic on monthly reporting rather than quarterly and annual. In June 2015, a required independent audit of Health Republic's 2014 annual report raised some serious concerns about the accuracy of Health Republic's financial statements. So DFS promptly commenced a thorough investment of whether or not the company would continue to be viable. We rejected Health Republic's increasingly optimistic projections that they would be solvent. They were predicting themselves solvent through 2016. We weren't buying it. We didn't accept it, and we decided in September, 4 months later, to shut Health Republic down. We did this because we didn't feel we could put consumers or providers at risk of going through 2016 and risking, financial meltdown in the middle of the year. Initially, we announced that it was going to be shut down at the end of the year, December 31st. We had an on-site review the first 2 weeks of October that showed some financial discrepancies, further discrepancies in what we found, and we decided we couldn't risk going to the end of the year, that the best thing for both consumers, to protect consumers, and providers was to shut them down a month earlier at the end of November. So that's what we did. Now, so once we made that decision, we worked very closely with providers, with health plans, and brokers to take a number of steps. We worked with providers to keep the network intact through the end of November, the MagnaCare network. We worked with plans on crediting the deductible for December, the 2015 deductibles, and the maximum out-of-pocket. We protected consumers from balance billing by providers under the New York State law. And we ensured the legally required access to out-of-network providers if there's not an appropriate in-network provider pursuant to a law that's been recently passed. And in addition, we ensured the continuity of care for Health Republic members who are pregnant or in certain serious treatment with providers such as Memorial Sloan Kettering. So despite the difficulties and unique difficulties presented by Health Republic, I think what it shows is that the state acted decisively. We worked with our partners at Department of Health and CMS to shut them down shortly after real concerns arise from that independent audit. And we acted to protect consumers and providers to the maximum extent possible. So, and I did want to, before turning it over to Donna to talk about some of our transition efforts, I did really want to thank the health plans for working with us on, and they've undergone a lot of difficulties in some of the work they've done to credit the deductible and maximum out-of-pocket expenses. They've had some adverse selection, certainly from some of the members who's transitioning over, and we really appreciate the partnership. We also appreciate hospitals and health and providers, doctors, for stepping up to the plate and continuing to provide care through the end of the month. And certainly, last but not least, the brokers and navigators for helping people transition, really important piece of it. So turn it over to Donna. Thank you.
Thank you. Thanks, Troy. Thank you, Senator Hannan, Senator Seward, for including us in today's roundtable. Thank you to the other senators here as well today.
Could you get a mic? Could you get a mic and pull it close? Thank you.
Certainly. Following on Troy's comments, I'd like to just focus my remarks this morning on what the marketplace did in collaboration with the Department of Financial Services and many people around the table and here in the room today to help Health Republic members get new coverage and avoid an unexpected gap in coverage and potentially in access to medical services. So like you said at the start, Senator, our focus and our concern has also been on making certain that people have coverage and access to medical care. And the marketplace used its resources to act quickly and decisively to move people into new coverage starting as early as December 1st. I wanted to go over just a couple of the things that we did, and then I wanted to share with you the results of those efforts this morning. So first, we established a dedicated helpline staffed with specially trained representatives at our New York State of Health Customer Service Center. They stood ready to answer questions and to help people select a new health plan that best met their needs. Between October 30th and December 31st, the helpline answered 64,000 calls, often many thousand calls a day. We also used our New York State of Health technology systems to quickly deploy a direct-to-consumer awareness campaign. That was a series of progressive communications that included regular mail notifications, email notices, and automated call reminders. Between October 30th and December 31st, we made more than 350,000 points of contact with Health Republic consumers, all with the goal of helping ensure that they were aware that their coverage with Health Republic would end and that they knew that they had ways to get assistance to select a new plan and remain covered. Given the marketplace and off-marketplace enrollment, our outreach efforts were really focused on 4 distinct groups. And I want to touch briefly on each of them and tell you what the results are today of people retaining coverage. First, individuals who enrolled in Health Republic through the marketplace received up to 6 contacts from the marketplace during the October to December 31st period. As of today, about 82% of those individuals remain enrolled in coverage through the New York State of Health Marketplace. This is a retention rate that is about commensurate with what we would expect based on our past experience with annual renewal periods, both here in New York and throughout the nation. We didn't want to limit our outreach efforts, however, to only those consumers that bought through the marketplace. So working with the Department of Financial Services, we extended our outreach activities to people who had enrolled directly as individuals in Health Republic. And here our goal was really threefold. First, to increase awareness, make sure they understood that their Health Republic coverage was ending on November 30th, to get a better understanding of whether that group of individuals had been able to enroll in coverage, and importantly, to offer them the marketplace assistance if they so desired, to help them apply for coverage and enroll and perhaps receive financial assistance as well in the process. The response we got from these consumers was really very positive. About 85% of the off-marketplace individuals, those that had purchased their coverage directly from Health Republic, responded to us saying that they had enrolled in new coverage as of December 1st. About 150 or so asked us for help. We've reached out to all of them through either our in-person assisters or our customer service center. Turning to small businesses for just a minute, as of November 2015, about 1,750 small businesses covering about 3,500 employees had enrolled through the Small Business Marketplace or SHOP. We communicated directly both with those small businesses and with the insurance agents and brokers who had assisted those businesses in enrolling through our SHOP marketplace, and about 50% of the businesses are still purchasing on the marketplace. So in the process of understanding whether the remaining businesses became insured, but based on the results that I'm going to talk about next off marketplace, we believe that most of them were able to enroll in insurance through one of the insurers in the small group market that doesn't participate on the SHOP. Finally, we surveyed small businesses that had purchased their coverage directly from Health Republic. Nearly 80% of them who responded to us said that they had, in fact, found new coverage so that their employees would have continuity of coverage and care. Nearly all of them reported that they did so with the assistance of an insurance agent or broker. So just to wrap up, I just would comment and reiterate what Troy said in part, and that is that we're very fortunate to be operating our marketplace in a state with a very competitive insurance market. And when we called upon many organizations, including the health plans, including our in-person assisters, insurance brokers and agents, the healthcare provider community to assist us in the transition, they all answered the call. And so today, I'm pleased to report that the vast majority of members have successfully transitioned to their new coverage. We remain committed to continuing to provide assistance to those who still need to make the transition. And as always, we're committed to ensuring that New York residents have access to high-quality and affordable care through our state marketplace. Thank you.
Well, thank you for those reports. And my reaction is in terms of getting coverage for those who lost it with Health Republic. I think those efforts are very commendable. Certainly each department's outreach efforts as well as cooperation of the insurers that have stepped up to the plate. I think that combination has provided the substitute coverage that's very, very important. I really had, before we move on, obviously we want to get the insurer's perspective, provider's perspective, but before doing that, I just had really two questions for our respective departments, and that is, at the outset, we heard a number of people around the table said that the demise of Health Republic was predictable. I guess my question to you is, did the department see this in time, and where was the prior approval rate-setting responsibility of the department, setting a rate that is maintains the this lowest rate possible, at the same time maintaining the financial viability of a health plan here in New York State? Where was the prior approval process in that? And my second question would be, terms of when DFS would be issuing some sort of formal liquidation in terms of Health Republic. Is there a plan and a timeline for that? And when will we have a clear sense of the total debt that is owed to the providers and where the funds will come from in terms of covering those unpaid claims?
Great, thank you. So I'll take that. With regards to prior approval, the department approves and approved Health Republic's rates as submitted, and they were actuarially reasonable rates at the time that they were submitted. And happy to talk more about that, but when they were submitted to us each year, we looked at those, reviewed them, and they were actuarially supported by actuarial evidence. With regards to liquidation, at this time we've been working with Alvarez and Marcel, who's the independent monitor, manager who's in there. And they are working on the wind down of the plan and of Health Republic, and so we do expect that it will be in liquidation. There's a number of key things that we're still working through as part of the wind down of Health Republic. One of them is that's outstanding is the IBNR, the incurred but not received, meaning the outstanding claims that are still coming in. The other is what are called the 3 Rs, the reinsurance, risk corridor, and risk adjustment payments. And our goal is to maximize the assets, to make sure that providers are and brokers and everybody else is paid to the maximum extent possible. So we don't have a date. The short answer is we don't have a date yet.
Well,
We're working.
you need to actually have a formal proceeding to have
Right.
a liquidation. And then
Exactly.
you can start to amass the assets formally. And until you do that, this is still a going concern.
Well, and we want to be able to get in claims and, again, resolve, get a clearer picture on some of the 3 Rs that are receivable. But you're right, there needs to be a liquidation proceeding, and the liquidation proceeding, I'm sorry, you were going to...
No, it says the question is, you obviously have policy reasons for doing what you're doing. The question should be whether or not the statute should reflect that type of intermediate stage.
Whether there should be something in between liquidation and non-liquidation.
Right.
And you're right that a number of states do have an intermediate sort of, where the Department of Insurance in those states can more formally supervise, and that does exist in other states that doesn't exist in New York.
Is there obviously, as has been pointed out, there's a process that has to unfold here to get the final numbers in terms of claims and what the assets are and how those claims could be covered. Is it the department's position that you want to see these, you can figure out a way to have these claims covered?
Well, it's the department's position that we want them covered to the maximum extent possible. We're really trying to, marshal all the assets and fight for every dollar to make sure that, we know that there are providers and others out there who are owed money. I think we've already indicated I know we've already indicated that there will be modest payments that, for providers. So we know that already, but the exact amount we don't know yet.
Let's go to some of the